All right, hi, I'm Josh. I'm with Comprehensive In-Home Therapy, and today we're going to do some Hoyer lift training. So a lot of you have probably seen a Hoyer lift in some of the homes that you are in, and it can look very scary, right? Kind of complicated, but it's really not. It's pretty simple, and once you get to know it, it's just kind of common sense. So we're going to talk about some of the parts to it. So this is the sling attachment. So this is where your sling loops will go, which a lot of you probably know that from your work. This is our hydraulic pump, and this is the mechanism that pumps it up and down. And then this is our release valve right here. Now, for a lot of you, the release valve is not going to look like this. What you've probably seen is a little tab, either probably up here on the top of the hydraulic, and sometimes it's kind of down here. But that tab is a little bit tricky, a little more tricky than this valve right here. So we'll talk about some of the issues that you can find with that release valve that's up here. And then this is the spreader. So this is what spreads the legs apart. If I can get it to, well, this one's stiff. And then these are the brakes right here. So let me see if I can get this the legs apart. There we go. All right. So with that, this one the spreader locks into place in little grooves, but in most of them it doesn't. So in most of them you just move it and it'll spread them apart or open them up. So I'm going to talk through the steps real quick, and then I'm going to have someone come demonstrate. So the first thing that we're always going to do is we work with the patient, right, or the resident or client, and we try to get the sling underneath them. So just like you would put a pad underneath someone in the bed, you're going to put the sling underneath them. And you want to make sure that the loops are on the back, so they're facing the bed, because you don't want these on their skin when they're in the chair. This would cause like a pressure sore, and you want to use these to help position them. So you want to make sure that those are in the back, right? So we're going to roll our sling just like you roll a pad, position it, and then the patient's going to roll back and forth. We'll get the sling under them, and then we'll position our lift. So positioning the lift, you want to make sure that you try to get it to where you're close enough to both sides of the loops, and then you're going to use your release valve to let the sling drop, or the bar drop. Now I'm just going to go ahead and do this quickly because I'll have Mychael do it with me in a second, and we'll put our tabs on. You want to use the same color on each side, obviously, and you'll have to play around with what color you use because each person's different. I typically like to try to do the purple one on the top, or the second to the longest one. But if it's someone who's really small, you'll want to go up. Okay. And then let's see. And then we crank it up, and we'll position them in the chair. Okay. So Mychael, do you want to come over here? Mychael's going to lay in the bed. And so before I even start putting the sling on her, I got to think about, where is the chair going to be? Where am I taking this person, okay? Because I don't want her in the sling and be like, oh crap. Well, now I've got to leave her to go do something, because she's not going to feel comfortable hanging in the sling for a long period of time. And if you have the release valve right here, she might accidentally hit it with her foot and then drop, right? So what we want to think about is, let's set up the room to begin with, okay? You see our chairs over here, right? And it's not in a good place. So I'm going to position the chair so that whenever we get her, it's going to be facing the sling, okay? And you might have to figure this out in the room that you're in. Some rooms are very tight. So I'm going to go ahead and position the chair where I think we're going to need it. Lock the brakes so the chair doesn't move on me. And then I'm going to come to Mychael. How are you doing, Mychael?
Good.
Okay. So I'm just going to kind of get this in position so that once I get the sling on her, I'm ready. And this bed is really short, so it's making it difficult for me. Alright. Will you roll that way for me? Okay. And you'll notice that this part right here needs to be up towards the head along with the tag. Okay? Because you want that kind of higher up. Roll back. Good, and then you're going to roll this way.
Okay.
So, and I'm going to use, if you have a small bed like this, you're going to want to use your body to keep them from rolling off the bed, just like you would if you were, changing somebody or putting a pad on the bed or something like that. All right, there you go. All right. And notice that she just did something that most people can't do. So go back to where you were.
Yep.
Okay. Go ahead and lay on your back. And you did a little bridge to position yourself. So
Yep.
do your bridge to come back to the edge of the bed. Okay. So sometimes you'll see the pad is not right? It's not even. So what you're going to have to do is you're going to have to say, okay, roll this way for me, Mychael. Good. And I'm going to position the pad just a little bit, right? Just like, a lot of times if there's a pad on the bed, you wouldn't do that. But for the sling, it needs to be in the middle. So, all right, then roll back to the other side. Roll back again. And we're just going to pull it. All right, now lay it back on your back. Perfect. So now it's right in the middle, right where it needs to be. You'll notice that the sling is about at her shoulder right here. The reason that I do that is because once she gets picked up, she will slide down a little bit, and I don't want her sliding too far that way, right? So if it's at her shoulder, it'll come up over her head once we pull her up. All right. So I check again, make sure my chair's in the right place, and I'll bring the lift down, and I release it. And I try to watch, okay, because at any time, I don't want her hands in the way. I don't want this to be like pressing on her. Some of the lifts that you use don't have a shape like this. They're more of a bar. And you have to really watch that you're not going to like press down on someone with the lift, because people get really nervous about lifts. There we go. So now I'm going to stop it. All right. And then Mychael, I just want you to be like a limp noodle, okay? Like, you don't need to do anything. All right, I'm going to go with the purple on the top here. And then here on the bottom, I'm probably going to go with green. And this is just trial and error. I mean, you just got to try something. As long as the loops are attached, the person's not going to come out of it. It just might not be as comfortable as it would be otherwise. So once you do this the first time, you're like, okay, this person needs their head up more, then you'll use a shorter part on the head, right? And you'll see what I mean when we get to put her in the chair. So I usually don't lock the lift at this point because I'm going to want to move her quickly once I get her up. But I'll lock the lift before I put her in the chair, okay? So remember, we're closed because we lowered it and then stopped. And so now what we're going to do is we're just going to crank it up. And there's a whole lot of cranking to be done here. And a lot of times what I'll do is I'll check on her as we go. Like, okay, I don't know that she's getting super comfortable right there. So I'm going to grab this, pull it over her shoulders so it doesn't dig into her shoulders. And see her knees, how they're starting to hyperextend. So I'm just going to kind of position the sling so it gives her a little bit of knee bend. Because I don't want it to be uncomfortable, and it's not comfortable. So I want it to be as comfortable as it can be. And so see here, we've got some fabric. So I'm just adjusting, right? I'm just going to adjust a little bit. There you go. And now she's got a good seat, right? And if you think about it, you're going to imagine her sitting into a wheelchair after this, right? So you want her kind of in that seated position in order for her to fit well in the wheelchair. And I'm bringing her up so that she'll be able to get in the wheelchair. And it's a lot of work, so don't be afraid to work. All right, so it's closed. I always double check, is she lowering before I start moving? Because sometimes, are you okay?
Yeah, I'm okay.
Sometimes those valves, if they're even just a little bit, because this valve is really nice, but most of them have a little tab valve. If that valve's just a little bit open, she'll slowly start lowering down, and I want to be aware of that. Some of them are older lifts, and the hydraulic isn't as good anymore, and that's just what they do, is they slowly lower. I want to be aware of that so that I can, if I see her starting to drop, I can pick her up a little bit more, okay? I also want to make sure she's not holding on to the bar because I don't want her hands to get caught in anything. Now when we get to this point, we're in an awkward situation for movement. So what I want to do is I want to rotate her to face me, okay? And I got to be very, very careful. Some people might have an old knee injury or something, and I don't want to hyperflex their knee. So I'm going to use my hand on the sling. Instead of pushing on them, I'm just going to push on the sling to try to get her foot on the other side. So I've got one foot on each side of the hydraulic, and that allows me to be able to move her safely, and once we get to the chair, we'll be in a good spot, okay? And a lot of times with carpet, you might have to move the chair more than you move the full lift. This carpet's easy. All right, now I'm in the place where I'm lined up with the chair, right? And I'm on carpet, so I don't really want to move the lift anymore because it's going to be clunky, right? It might feel like it's shaking a lot or tipping because we're on carpet. So I'm going to go ahead and lock our lift, and I'm going to grab our chair instead. Okay. And notice that I forgot to spread the legs apart. That's okay, sometimes you forget to do things, so I'll do it now. Spread the legs apart, and now I can get the chair in there. And I'll put the chair under her so that she'll be in a good seat, right? Okay, so I think she'll fit well in there. I'm going to lock the chair down. Okay. And now, this part gets a little bit tricky for people because they're like, how do I manage her and the lift at the same time? Sometimes that's where this comes in handy, this lowering mechanism at the top, because it's easy to grab, and sometimes you can grab it, and I can say, go ahead and let yourself down. This one is down here, so we're going to open it just a tiny bit. There we go, so she moves slowly, and I can get behind her and kind of make sure that she's in a good position while it lowers itself down. And I tilt the chair just a little bit with mine. See my legs right underneath the chair? I'm supporting her. She's got anti-tippers. She's not going anywhere. But I just want to make sure that she's as far back in the chair as this thing's going to let her go. And see how slow that valve was opening? That's because I barely opened it. I didn't want her going down fast because I needed to come manage the chair, right? And so now I want to make sure this isn't going to hit her in the head, right? So I've got to close this before it touches her, right? Usually it's not going to do any damage. This thing's not very heavy. But I still always want to be as mindful as I can about the person that I'm transferring. I don't want them to feel uncomfortable at all. So, and some people will be very uncomfortable, and especially the first time that they're being lifted. If you have a resident who is coming from a skilled nursing facility and they're coming home with a lift for the first time, this might be a scary experience for them, because a lot of times in a nursing home, they might be transferred by therapy, or they might be transferred by 2 CNAs. Well, at home, you're not going to want to put that risk on yourself, and so they'll send a lift home with that person. And so it might be the first time that they're really doing a lift at home, and so you just want to stay calm. And if you forget something, just wait a minute, right? If you know something's not right, just take a minute and breathe. You can either start over with the whole process or just try to figure out what's going on. As long as you have those loops in the sling and the valve is closed, you can take a minute to breathe and make sure everything is right, right? It's not difficult. It just has a lot of moving parts, right? So that was pretty easy. What did you think, Mychael?
It was not bad.
It was not bad, right? I want to check to make sure she's as far back as she can be in the chair. So go ahead and lean forward for me. Okay, so what I'm looking for is I'm looking to see that her bottom is all the way back in the chair, okay? She's got a couple of inches. So if she can scoot herself back in the chair, obviously that's preferred. But if not, you know, what I'll do is I'll grab the sling on the sides of her hips and just lift up just a tiny bit, and it will just scoot her back an inch. Does that feel comfortable?
Yep.
There you go. All right, so then we'll do the reverse to get her back out, right? It's the same thing. We want the chair and the lift already positioned where we want to be before we start. And you really want to make sure, see how this thing is swinging closer to her face? Kind of did that on purpose so that way it would, you know, cue me, right?
Yep.
But I don't want you to do that. I want you to make sure that you've always got a hand on this and you're controlling it. Because you just want to be mindful of the person. What is the person feeling? What are they thinking? If you were in their position, what would you be thinking? Alright, so we decided that we're going to do purple on top and we're going to do green on the bottom. So we're going to do the same thing going back to the bed. And I think you should think about when you're working with anybody, you should always think about what would you feel if you were in their position. And that might help you feel like, oh, are they comfortable or not, you know? So I'm making sure that my brakes aren't locked because I'm gonna be moving this in a minute. And I always just keep a foot on it, keeps it a little bit more stable for me. Now, when I get to this point, I always, when I'm from the chair to the bed, I always check to make sure that my loops are still on, because sometimes from the chair position they can kind of slip. So all my loops are on, perfect. Now I don't have to worry about it anymore. And go up, up, up. Are you comfortable?
Yep.
Okay, good. And it might not even be, are you comfortable? It's like, are you okay? Do you feel okay? Alright, so I know that we've got enough there. Move the chair out of the way. Alright. And remember, we don't need these legs spread out anymore, and it can cause trouble if they're all the way out. So I'm going to go ahead and bring them in. Alright, you ready to move?
Yes.
Alright, so we're ready to move. We're going to rock and roll here. We're going to go under the bed. Now, are you cool to sit here for a second?
Yeah.
Sometimes there'll be cords under the bed. That's because you might have an electric hospital bed or a semi-electric hospital bed, and there can be cords running under the bed. I always advise either trying to tape the cords up to the bed, or have the family do that, or just make sure that they're like kind of moved out of the way. Because when you hit a cord with this thing, it will jerk like that, you know, and it will be kind of scary for a second. You'll be like, oh my gosh. So just try to make sure that the cords are taped up or moved out of the way. Once you get here, you're going to be like, okay, think about where her bottom should be, right? Because I don't want her head all the way down at the foot of the bed. So just like if you were transferring someone, you'd want them to be their head closer to the head of the bed. And then we're going to do the same thing, moving her this way. Yep. And notice that her feet touch the bed. So if she can pick her feet up, then she'll do that for you. If not, you can just help her. There you go. Alright, now we're going to slowly lower down. And when we're lowering down this time, I'm focusing on her position in the bed, just like we were focused on the position in the chair. I want to make sure that, you know, she's going to be comfortable. Alright. that her knees aren't going to bend too much if she has an old knee injury. I'm going to make sure that her head is going to hit the pillow the way that she wants it to, be comfortable for her. So I'm always thinking about, if I was that person, would I be comfortable, right? And then close my valve and take the loops off. There we go. Back up. And then same thing, I just take the sling out. So go ahead and roll that way. You know, roll it up just like I would roll up a pad in the bed. Alright, then roll back this way. And then bring it out. Now sometimes you want to make sure if the pad is wet, you want to try to see if it's sweat or urine. And you know, you could ask the client, or if you can smell it, then you'll know, right? If it's got urine on it though, you probably need to wash it. And then if it's sweat, you can let it dry. But there are different types of slings. That one is a full body sling, but they also make what's called a U-sling. And a lot of you will probably see that. And it will literally be shaped like a U. I think I have a picture on here of a U-sling. Let's see. Yeah. So this is a U-sling right here. Okay. If you have a U-sling, go ahead and lay down with that. If you have a U-sling, this top part of the U, it's really more like an N. This top part will go under her shoulders, just like we saw before. Her shoulders and her low back. And then these two straps, you don't want them to be on the outside, okay? Because if you think about it, if they're on the outside and she slides forward, where's she going to go? In the floor, right? Because that just creates a hole for her to slide through. So we want to cross these underneath her legs to go in between her legs, okay? That creates a harness for her, and that will hold her in. Now, people do this different ways. Some people will, if a strap goes around her leg, they'll strap it on this side, and then if it goes around that leg, they'll strap it on this side. And some people cross them, okay? We recommend that you cross them. So if it's going underneath this leg, we're going to hook it on this hook. And if you go under this leg, we're going to hook it on this hook. And that's because it just holds her legs closer together. It's more comfortable. But either way is still safe. So if you realize that you did it the other way, that's okay. As long as it goes under her leg and hooks up in the middle, okay? And not on the outside. They also make, you know, this 2-strap sling set. You probably won't see that. If you do, you know, it just straps like that. But this is a really rare setup. Now this right here is what's called a hygiene sling. It has a hole in it for toileting and showering. If you do use a hygiene sling for toileting or showering, you want to make sure that this hole is around their like anus area, so that way they can have bowel movement or whatever they need to do. You can use this to put them on a bedside commode or to get them onto a shower chair. This obviously needs to be cleaned after doing any kind of hygiene. This sling, I don't prefer this sling for like sitting in a wheelchair all day, because the mesh can be kind of hard on their skin. But if that's all they have, that's all they have, you know. But if you do have a mesh sling and that's the only thing you have, recommend to the family that they try to get a full body sling as well, so then you can have both to use interchangeably. So just some tips for success. You can sit up. You want to, the first start, just like I said before, you want to clear your path to make sure you're going to have space to move the lift and position the chair. And you want to go ahead and position the chair to begin with, right? That way, you know where you're headed. You've got a plan. If you've got a plan, things are going to go so smooth. Log roll side to side to get the person on and off the sling. If the sling doesn't look like it's in the right position, with the top of it at the shoulders, and then positioned right in the middle of it, just adjust it as you need to. Let the client do the work, right? Like, let the client roll as many times as you need to position that sling, because you don't want to hurt your back pulling on the sling. You want to make sure that the client is, and you probably saw me bending a lot in this, but it's because this bed is so low. On a normal hospital bed, it wouldn't be that low, so it wouldn't be that much bending. Hook the sling and the sling attachments, and just double check, make sure that they're hooked. Usually they'll always stay hooked, but you just always double check just in case. And make sure that they're on the same color, right? So we did purple and green. Try to keep the patient in a sitting position. So what we did there was we adjusted you while you were coming up from the bed to make sure you were in a seated position, right? Mm-hmm. If we did the loops wrong, we did green and green, and that wasn't right, I mean, the next time do purple and green. You know, try it out differently until you get that seated position. You looked like you were in a really good position for the chair, so that was good. Obviously, use the spreader to open it up and get the chair in there. If you feel like something's wrong, this chair is not getting underneath her or him, then it's probably because your legs aren't spread out. And it's okay. Sometimes you forget to do that, like I did. I had to go back around and open it up. Encourage the person not to hold on to this, because they could get injured with this, so we don't want them holding on to it, but some people will insist. So if they do insist, just watch them carefully, just like I was watching you. This thing was dangling around. I was like, I don't want that to hit her in the face. If I was in her position, I wouldn't want to be hit in the face. Nice. So you just think about the client all the time. What are they feeling? Use the guide handles to position her. I don't know if I think I showed it. I don't think I said anything about it, but when she was going into the wheelchair, I was holding on to this loop here to help guide her into the chair, right? Obviously, I don't want to pull on her. So this is handy. It always has like a loop you can hold on to try to just pull her into the chair as she goes down, so that way she gets as far into the chair as she can. Then we can adjust a little bit once you're in the chair, but that doesn't require a lot once you're already in the chair. Pad areas where the legs come into contact with each other or with the sling. It's not necessary for most people to do that, but if someone has really poor skin quality, they look like they could get a skin tear really easily, then what I'll do sometimes is, if the sling I'm just going to show right here. If the sling is right under their legs like that, and I just am nervous about it, I might, you can use a pool noodle that's cut on one side to put it around the edge of the sling. You can use bubble wrap. You can use a towel, fold it up, and just put it between their skin and the sling, right in that crease, so that way the sling doesn't rub and possibly cause some kind of shear on their skin. It's like I said, it's not typical that happens, but if you have someone who looks like their skin is gonna fall off, which you have probably seen those people before, especially if they're old, like really pretty old, or they're dehydrated, you do kind of want to protect right under their legs. And some people will have a lot of pain where the sling touches them if they have lupus or they have some other medical condition that would cause a lot of pain. And just putting like a folded up towel between their skin and the sling can help a lot with that pain and make them feel more comfortable. You want everyone getting out of the bed as much as possible, because that's going to prolong their life and improve their quality of life. So if you can make them comfortable with the Hoyer lift, then you're going to be able to provide them that quality of life that they wouldn't have laying in the bed. So it's really, really important. Let's see, what else do we have as tips? We talked a lot about the carpet. If there's carpet, it's easier to move the wheelchair than to move the lift. We got to get the lift at least positioned so that, out of the bed and positioned like this, but it's easier to move the wheelchair on carpet than it is the lift. I have actually a lot of times gotten permission. Well, because I'm a therapist, so I do a lot of like home modifications for people. But what I'll recommend a lot of time is that someone will pull up the carpet in that room that we're using the lift and put down a vinyl flooring. But I've even pulled up carpet for people and just used the subfloor because it's easier than the carpet. Of course, like as a caregiver, you're not going to be the one pulling up carpet, obviously, but you know that might be something that is recommended because the lift can be very difficult on carpet, and you want them to feel secure. And a lot of times, if they get care, 5 days a week, and then the other 2 days a week the family is caring for them, then the family is going to want to be able to move the lift too, and the carpet's not going to be worked for them either. So I do recommend pulling up carpet if possible for the family. So anyway, do you guys have any questions?
I don't think so.
Do you feel like it was pretty clear?
Yeah.
Okay.
Yeah.
I know that there's a lot of moving pieces, but it's made to be safe. The biggest places where you could have error are going to be this thing, like hitting somebody in the head, or
it came really close.
Right? Yeah. I mean, like, it's just one of those things that, like, that's where you put yourself in the client's shoes, and if something does happen, it happens, and you move on. Don't take that as a like, oh my gosh, I'm never doing this again. Take it as a learning experience, and of course, be open and honest about everything that happens in the home. That's how you keep your place there, and that's how you create like a healthy environment for the care center. But if that does happen, you just be honest about it and move on, do it again. Most clients are gonna be like, oh my gosh, I didn't even see that there.
Right.
You know what I mean? So anyway, if you guys have any questions at all, feel free to reach out to us. The care center has all of the contact information. And if you have someone that's particularly difficult to transfer with a Hoyer lift or otherwise, feel free to reach out to like therapy. It can either be through the home health company that they're with, or if they're not with home health, going through a Part B in the home therapy, like comprehensive in-home therapy, because we might be able to make it easier for you. We might be able to modify the environment. We might be able to, strengthen the person or improve their flexibility to make it easier for you to do those transfers. So don't think that like you're alone in this, right? If you need help, reach out, because there are services that can help you.
Thanks so much, Josh.
Yeah,
Thank
no
you.
worries.